Morning sickness you can go about your day with. HG you cannot. For you, how did you know you had HG? Like, what happened? The vomiting under control to some extent, it didn't get rid of the nausea. I was nauseous like 24/7.
Wow.
For 9 months straight, 24/7.
9 months straight.
I'm here with my girl, Wiz. Hi, Wiz.
Hi, Kim.
And who happens to be my friend.
Is there anything that made you feel better? Anything you ate?
You were still a mom.
Mm-hmm.
You're a wife. You're a businesswoman. Like, how did you function?
It makes your daily living a nightmare. Whenever I would step outside of my house, walk around with a plastic bag in my bag, because I knew that at some point I would probably smell something or eat something and then throw up. This medication was like my lifeline. If I left the house without this medication,
It would be over.
it would be over. And literally every morning, he would have to go to the store to get me something.
So if there are any partners listening out there,
Okay.
Your wife or whatever, they're not exaggerating. They're actually really sick.
hey everyone, welcome back to another episode of Woman Word Podcast with me, your host, Kim Marie. This is a space, a community where we empower newly pregnant and postpartum moms through faith, real stories, and expert guidance. And today I'm here with a special guest. She is the CEO of Glorious Push Birth, a birth and postpartum doula, a placenta encapsulator, a childbirth educator, a breastfeeding specialist, and an advocate, and who happens to be my friend.
I'm here with my girl, Wiz. Hi, Wiz.
Hi, Kim.
Can I just say, I love what you're doing. I love the advocacy. I love how you're a powerhouse in the tri-state area.
Oh, we have to.
Yeah. And you traveled across the ocean to be here. So
Across many waters.
So I guess we could dive right in. We're talking about Hyperemesis gravidarum. It's something that you are open about. You do a lot of advocacy about it, and you tell your story. You're an open book when it comes to it because you've experienced it, and it's something that you dedicate part of your practice to, which I appreciate. So I guess what can you tell people about Hyperemesis gravidarum versus morning sickness? Because studies show that 3% of the population suffer from Hyperemesis gravidarum when they are, or HG, when they are pregnant. And then, we may seem like 3, that's a minuscule number, but no, that's a large part of the population, So what can you tell, our listeners about the difference between morning sickness and HG?
I would say number one, morning sickness you can go about your day with. HG you cannot. Morning sickness you can kind of find, homemade remedies, certain things to help alleviate the symptoms. But with HG, there's really not much that you can do. And most of the time you have to go to the hospital to get any type of help to make it stop. It's really extreme compared to morning sickness.
So it's an actual condition.
Mm-hmm.
It's not like, oh, you're just experiencing,
nauseous,
exaggerated morning sickness. This is a real condition that women who are pregnant suffer from.
Mm-hmm.
And for me, I feel like it's underdiagnosed and there's a lot of misinformation and it's not widely spoken about.
It's not.
So for you, how did you know you had HG? Like, what happened?
I knew I had HG because I had learned about it in my doula training. That was the only way that I was able to spot it. But honestly, if it wasn't for that, I don't think I would have known that I had HG probably till like weeks, maybe months later.
Wow.
Mm-hmm.
So not even your providers were able to give you information about it?
No, my providers did not catch it. It actually, one of my ER visits, that's where I was officially diagnosed with HD by an ER doctor. But I already knew what it was. So,
Yeah.
But when it came to my providers, they were kind of like, because I was still in my first trimester, they kind of like, it's probably just some severe morning sickness. It'll pass. and it didn't pass. So yeah, but it was the ER doctor who saw it as HD and diagnosed it as HD. But across the board, they kind of treat it all the same.
Yeah.
They're kind of like, okay, you just get some IV fluid, some Zofran, and then go about your day.
Yeah. Is there anything that made you feel better? Anything you ate? Any medications that were prescribed? From what I've understood, it's almost like you're just done all the time. You're empty. Nothing tastes good.
There isn't really anything that makes you feel better, at least for me in my case, because there's really a variety in how women experience HD. But generally, for the most part, you can only alleviate some of the symptoms, but you can't really get rid of it. So for me, the medication would decrease the amount of times that I would, throw up. It would keep the vomiting under control to some extent. It didn't get rid of the nausea. I was nauseous 24/7.
Wow.
For 9 months straight, 24/7.
9 months straight.
9 months straight.
Do you understand? It was 9 months straight.
9 months straight. There was not a time that I was not nauseous. I would go through my pregnancies really trying to remember what it was like to not feel nauseous. Yeah.
And you're a mom of 2, so that means there was sort of like this double whammy, I guess.
Happened 2 times, twice.
And nothing at all helped you.
No, not get rid of the nausea. The medication helped with decreasing the vomiting. Because the thing about vomiting when you have HD is that it's not controllable. So when you have morning sickness, you'll feel nauseous. Maybe you'll want to vomit or you'll vomit and then you'll be relieved. With HD, it doesn't stop. Your stomach will continue to pump everything out and you can't control it. You can't keep it in. You can't do anything. So with the medication, it would keep it under control to where I wouldn't be throwing up so much, but I would still throw up at least 2 to 3 times a week. And yeah,
even with the medication.
But without the medication, it would be every day, all day long.
So how did you function daily? So for instance, your second child, you were still a mom. You're a wife. You're a businesswoman. How did you function?
Life was really on the standstill. I didn't really work during my pregnancies like that. Once I had the medication and everything was kind of under control, I could function, but I was miserable.
Yeah.
All the time. I was miserable all the time. Especially when I was pregnant with my son and I had my daughter. I have no shame to say that Miss Rachel raised my daughter during that time. I just could not deal. It was really hard. On top of the pregnancy, tired, fatigue, and all of that. Yeah, it was hard. I spent my first pregnancy, I barely worked. I only had myself while my husband went to work. So I just spent my days binge watching shows and trying to survive, literally.
Seriously, you're literally trying to survive.
Yeah.
And so many women get shamed for this. Oh, you'll feel better in the second trimester, or it's just morning sickness. Get over it. But it's no.
Till the very end, until you deliver, is there.
Until you deliver.
I
don't know. I've never had HG, but I'm just thinking of just being nauseous in general. To just live with that for 9 months.
9 months. It's crazy.
It's torture.
It is torture.
And there's a study I read where it said 25% of women, they said that they had suicidal ideation. And then 50%, I believe it was a sample of 5,000 women. And 50% was oh no, the suicidal ideations, it was there consistently all day, every day. They just wanted to die. How did you maintain your mental health? How did you keep yourself together?
I think that honestly, my faith is really what kept me, but it wasn't that those thoughts were not there. I didn't have necessarily suicidal ideation, but I definitely was depressed. I was just why am I going through this? Why does it have to be so hard? I can't wait for this pregnancy to be over. With my son, it hit me the hardest just because I went through it the first time, it was okay, it's the first baby. But then to have it again, I was just this can't be real.
Yeah.
And with my son, it was the worst. And it really got to the point where I was like, if I lose this baby, I wouldn't mind.
Yeah.
Because it was that bad.
Yeah. And it's not even about like shaming. It's just, bringing awareness. This is a serious.
It's that bad.
Yeah,
It really is that bad.
Yeah.
Yeah. It makes your daily living a nightmare. I had to, I laugh about it now, but I had to literally walk around whenever I would step outside of my house, walk around with a plastic bag in my bag because I knew that at some point I would probably smell something or eat something and then throw up. I had to sometimes, especially when I would drive my car, I would have a bucket there. In the car. Yes, in the car if I didn't have enough plastic bags. And the amount of places that I threw up in public, I mean.
Was there any specific trigger? Like if you smelt it or if you saw it, it would just be over?
Anything could trigger me. Stuff that smelled good. But typically it would be like artificial smell. So like scented stuff, scented candles, fragrances, that type of stuff. Those would trigger me the most. But sometimes food as well, or like even things that normally would smell really good to me, all of a sudden smelled like vomit. Like it smelled so bad. It would trigger me. So I would have to walk around with a mask, even though, it was around, after COVID. Yeah. It wasn't that out of the norm, but yeah, I would have to walk around with a mask and everything just so I wouldn't smell stuff. So I wouldn't be triggered. Yeah.
Wow. Did you ever feel guilt at all? Like, I hate that I'm experiencing this. Like, I wish I had one of those movies.
Oh, yes.
Definitely. Which, by the way, the movie Pregnancies, so stop it. They are so fake. I cannot even explain.
Yeah. All the time I'm like, oh my gosh, I can't wait to get to the end. I can't wait to get to the end. Just wanted to get it over with. I would look around and be like, wow, like I would love to experience a pregnancy where I wouldn't be nauseous or just have the regular morning sickness and then be done with it, But one thing that would like really, really piss me off is whenever pregnant women who would experience like severe morning sickness would try to diagnose it as HG. And it's like, I get that severe morning sickness is still like terrible to experience, but it's not the same as HG.
Yeah.
Like you're still able to function. Once your first trimester is over, you're fine. Like you don't have to make 20 ER trips because you can't stop the vomiting. Like you're functioning to some extent. Like, and it's not to diminish other women's experiences, but I saw that a lot, and that would piss me off. Like a lot of women, oh, I had HD, and it's like, no, you did not.
Yeah.
Like, of course, it's underdiagnosed, but no, you did not. That would piss me off.
Mm-hmm.
Man.
So one way they can know if they do have HG is the prolonging of it.
Not just the prolonging of it, but also the necessity for medical intervention. Right? Like if you have severe morning sickness, but after eating a meal, you're fine. Or, after popping the pill, you're fine. Like, or you're able to just go on with your day. That's fine. Right? You don't have to worry about your baby not getting enough nutrients. You don't have to worry about a lot of these things. But for somebody who has HG, you constantly have to worry about all these things. You cannot survive without medication, and half of the time the medication is not even enough because it's that bad, and it's like there's not much that they can do. For many women, they have to have a nurse come 2 to 3 times a week to give them IV fluids and give them medication through the IV because that's the only way that they can get relief.
Wow.
And even then it's just relief. It's not even like it takes it away. So
wow. Yeah. Wow. So how can moms, I guess, advocate for themselves if they do feel like something's not right? This has to be worse than morning sickness. Like something doesn't add up.
I think definitely research HG. I feel like even when people hear about it, they don't necessarily understand what it actually is. And just push for it, like present the information to their medical provider and say, hey, like I need extra support. This is not working out, especially if there's other things that's happening, like, their baby's growth is being restricted, or they're losing weight instead of gaining weight, or they're having issues with their amniotic fluid. Really relate that information to their medical provider that, hey, it could be HD, or those symptoms or things could be related to me possibly having HD, and seeking support around it. Yeah.
Did you personally experience anything with your babies either, or if your pregnancies where they weren't growing, or
Because HD is still something that is like newly diagnosed, and there's not a lot of research around it, it's hard to say that some of the things that I experienced was related to it, or if it was related to the medication that I was taking for it. With my daughter, she did have restricted growth towards the end, but it was not major. I believe she fell around the 8th percentile, but she basically just stopped growing at like 37 weeks. At like 37 weeks, she was 6 pounds, and she never gained more than that. But the one thing that I had with both my pregnancies was that I had extra fluid. I had not, it wasn't even severe polyhydramnios.
Oh, really?
Yeah.
Oh, wow.
Yes. With my daughter, it ended up resolving itself by the time I went to labor. With my son, it didn't.
Oh,
Yeah.
wait, can you just touch a little bit about what that is?
So polyhydramnios is when you have excess fluid, amniotic fluid in the womb. So for most people, it's supposed to be between a 5 and a 25, and I would go over 30.
What?
Yeah. So my daughter, it resolved itself. With my daughter, it was basically up and down. Like, I would go in for ultrasound, it would be high, and the next ultrasound would be back to normal. So it was fluctuating for some reason. With my son, it was just over, like, it was like 36 or 37 or something like that. So it was severe.
Wow.
Yeah.
And did any of them come early, or?
No, like, I wasn't I was induced with both at 40 weeks. So
They still wanted to stay in there.
still wanted to stay in there. But that's the thing too, like, when you have excess fluid, you're less likely to go into labor as well, because babies floating around, so baby's not really putting any pressure on the cervix. So yeah, but it's hard to say if it's related to having HD itself or from the medication that I was taking for HD, because I was taking that medication from like from like second trimester onward.
Every day religiously.
Multiple times a day. And I would honestly go over the prescribed like amount because it wouldn't be enough. Yeah, it would not be. And I was popping these like, I'm telling you, this medication was like my lifeline.
Oh my God.
Always had it, and I always had like two bottles of it. One that I would keep at home, and one that I would keep in my bag. If I left the house without this medication,
It would be over. Oh my gosh.
Yeah, it was bad.
What about like your spouse? Did he trigger you in any way? Like the smell? If he like came home like off from work,
My goodness. The thing about HD is that it made my sense of smell. Like, I know generally pregnant women, they have like a heightened sense of smell. Mine was like times 1,000. So, especially with my first pregnancy, my husband couldn't wear deodorant at home, couldn't wear any lotion, nothing.
Wait, hold on.
No cologne.
He could not wear deodorant?
No, it was such a trigger. And like, products for men that has such a strong smell to be getting
strong.
It's strong. So I had to get unscented everything. Unscented deodorant, unscented lotion, unscented soap. Oh, he did not like it. He did not like it. He would have to like wait until he leaves the house to put on his deodorant and everything to go to work. He couldn't wear any of his cologne. If he wore it, I would not be like near him at all. It was a trigger. Yeah, and then man, he went through it. I think one day he would have to tell his side of the story. Like, the amount of times that he had to run to the store to get me something, like, most of the time, whatever I would be able to keep down, because it was only a selected amount of things that I could keep down. And literally every morning he would have to go to the store to get me something and bring it to me before going to work. Every morning. For 9 months. Every time I think about it, I'm like, wow, like that's a lot of money right there. Every morning.
That's a great partner right there.
Okay.
That's what I'm thinking just hearing this, because that's what we want,
That's
that's what we want to hear as doulas, especially like partners about it. So, but dear God. Okay.
Oh yeah, but he was very worried, like just seeing me throw up so much.
Yeah.
He always says, I've never had to throw out so much vomit in my life.
Poor
Yeah.
thing.
Yeah.
So if there are any partners listening out there,
Okay.
your wife or whatever, they're not exaggerating. They're actually really sick. It's an actual condition and it's not great. It's not great at all. So even, a part of your advocacy, I do want to ask you, how can partners or maybe even doulas, birth workers, how can they help with recognizing HG or helping their clients advocate for HG, especially when the medical system doesn't a lot of the times?
Yeah, I think it's because of this idea that like it's rare. I don't think it's that rare.
Yeah.
I think because it's not diagnosed the way that it should be, it looks like it's rare. I would say especially for doulas to educate their clients on what HG is, because a lot of times moms don't even, like most people don't even know that there's such a thing as HG, let alone advocate for themselves concerning it. So I would say for doulas, definitely educate their clients on what HG is, the symptoms, and the fact that there is medication out there. And I would say for partners to really support the mom in any way that they can. If she can only eat one thing, let it be that one thing. If she needs to go to the hospital, whatever it may be, to do that and really make sure that they are receiving the care that they need.
Nice. Wow. So a part of Woman Word is where at the very end we have a segment called One Word, which just kind of ties into the word in Woman Word. So what's one word you would use to describe the season you're in right now?
Wow. Transition. Definitely transition.
I like that one. Okay.
Yeah.
That's beautiful. Well, thank you for being here.
Thank you for having me.
Can you tell, our listeners where to find you, maybe anything you have coming up or whatnot you want to promote or...
Yes. So you can find me on social media at Glorious Push Birth. That's on Instagram, IG. That's Instagram. TikTok, Facebook. I do have birth preparation classes coming up in New York City. So if you are expecting next year and you want to learn how to prep for labor, how to push, what positions to do, how to manage your pain, be on the lookout for that on my social media pages. And if you're looking for a doula, whether for birth or postpartum, in the New Jersey, New York area, I got you, okay? I got you.
There you have it, folks. Wiz, thank you so much. And thank you so much for everyone for joining us today. We spoke with Wiz all about Hyperemesis gravidarum, morning sickness, what you can do to alleviate it, and so forth. So please subscribe, share this podcast with someone that you know or with someone that you feel it would be helpful for. And we want to hear your HG story. So please send us an email and tell us your stories. We want to read it. I want to read it. And we want to respond. So thank you so much for joining us, and we will see you next time.
Bye.